Hello, my name is Jana Connerly. Thank you for viewing our presentation on cervical cancer in Malawi. With me today are my group members, Keandra Jones and Keishandra Porchette. I will begin by talking about cervical cancer and what it is. Cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. It primarily develops from the abnormal growth of cells on the surface of the cervix. It is the fourth leading cause of death globally in women. The global burden of cervical cancer is significant, particularly in low-income countries. In 2020, there were an estimated 604,000 new cases of cervical cancer and 342,000 deaths from cervical cancer. Approximately 90% of those deaths were from low-income countries. Cervical cancer rates are exceptionally high due to several factors like limited access to healthcare. Malawi lacks the necessary equipment, supplies, and trained personnel to effectively screen, diagnose, and treat cervical cancer because of its elevated levels of poverty. It makes it difficult for women to afford healthcare services, transportation to medical facilities, and even necessities that support overall health. There are several risk factors that contribute to the cervical cancer burden in Malawi. Women that become sexually active at an incredibly early age typically have multiple sex partners and become exceedingly substantial high risk for sexually transmitted infections. The primary risk factor is HPV, the human papillomavirus, which is a sexually transmitted infection or STI, and its prevalence is high in Malawi, along with HIV exposure. HIV weakens the immune system and increases the susceptibility to persistent HPV infections. Along with STIs, also another major risk factor is tobacco use because it can cause damage to DNA of cervical cells and weaken the immune system. DALYs, which are referred to as disability adjusted life years, is the total number of years lost to premature death as well as years lived with a disability. There are several DALYs in Malawi that include communicable diseases, maternal, neonatal, and nutritional diseases. HIV and AIDS, lower respiratory infections, and malaria and diarrheal diseases are among the leading causes of DALYs in Malawi. Challenges that face Malawi in preventing and managing diseases include the severe poverty, which affects 72% of the population. This extreme poverty level has been a persistent issue with slight changes over the past few decades, despite the efforts to improve economic conditions. Another challenge that Malawi faces is food insecurity, which is closely tied to the country's heavy dependence on agriculture. With over 80% of the population relying on farming, adverse weather conditions such as drought and floods severely impact crop yields and consequently food availability for Malawi. The third challenge that Malawi faces is health and sanitation. Access to healthcare and clean water remains limited, particularly in rural areas. This contributes to the high rates of disease and child malnutrition, with stunting affecting many children due to undernutrition. Now my group member, Keandra, will discuss SDGs and targeted intervention.
Thank you, Jana. As we continue to examine the healthcare disparities in Malawi, one of the main components is centered on Sustainable Development Goals, also known as SDGs. SDGs are implemented in order to end poverty and inequality. The main objective is that all individuals enjoy health, justice, and prosperity. SDG number 3 targets good health and well-being. This prevalence is significant as many women are poverty-stricken and are basically unable to afford healthcare insurance or even seek healthcare assistance. So some potential resolutions include access to prevention as well as early detection. Shifting into SDG number 5, this targets gender equality. Nearly half of married women in Malawi lack decision-making power over sexual and reproductive health rights. Barriers to accessing sexual and reproductive healthcare information and education persist due to lack of positive laws, particularly in relation to the HPV vaccine and sex education. Components to ensure sexual and reproductive health rights and laws include budget allocations and public awareness raising. Alongside the SDGs, we take into account the targeted interventions, which include the Cervical Cancer Control Program, the the Nakoma Cancer Program, as well as the MSF program. The Malawi, my apologies. Alongside the SDGs, we take into account the targeted interventions, which include the Cervical Cancer Control Program. This program was started in 2004 by Malawi Ministry of Health and the World Health Organization, also known as WHO. The primary objective of this program is to screen as many eligible women as possible and ensure appropriate management for women with abnormal results. The Cervical Cancer Control Program has had much success since it was first implemented. The Nakoma Cervical Program was initiated in 2013. The primary prevention method for this program includes the HPV vaccine, as well as education and awareness. The main objective is to prevent, detect, and to treat cervical cancer. The final program is the Medicine Sans Frontieres, also known as the MSF program, which was started in 2018. This program focuses on providing feasible, effective quality care to low-income areas. The effective purpose is to address inequities in access to prevent, diagnose, and treat cancer. Moving forward, Kishandra will now discuss the barriers of implications along with recommendations.
Thank you, Keandra. Malawi faced several challenges from healthcare staff shortage, proper education of the disease, cultural beliefs, and stigmas associated with cancer. This makes it challenging to implement new changes to reduce the cervical cancer mortality rate in Malawi. Recommendations to improve the mortality rate in Malawi include vaccinations, lifestyle changes, early detection programs, and various treatment options. These recommendations will help prevent HPV that is linked to cervical cancer and could lead to cervical cancer being a disease in the past. The first primary recommendation is the HPV vaccination. The recommended dosage for individuals at ages of 9 to 14 years of age is a 2-dose series, and individuals at the age of 15 to 45 years of age is a 3-dose series. The 3-dose series is also applied to immune-compromised individuals. Another primary recommendation is lifestyle changes that include tobacco use, healthier diet, and practicing safe sex, and scheduling routine medical care. The second primary recommendation is routine screenings, such as pap smears, which is to find precancerous cervical cell changes. If cervical cancer is found at an earlier stage, it's usually easier to treat. The second recommendation will be detection. If cervical cancer has been detected, treatment may consist of trachelectomy, hysterectomy, radiation therapy, chemotherapy, targeted therapy, immunotherapy, or palliative care. With these recommendations came obstacles that the World Health Organization faced. They face challenges such as the awareness of cervical cancer among the women in Malawi. To face this challenge, they recommended face-to-face seminars and educational flyers to hand out to the women of the community in Malawi. Another challenge that Malawi faced was the shortage of healthcare workers. To improve this challenge, World Health Organization recommended incentives such as financial bonuses and career advancement opportunities. HPV vaccination coverage is another challenge that the World Health Organization addressed. Logistical issues, vaccine supply, and ensuring the girls receive a full vaccination schedule are ongoing hurdles facing Malawi. The vaccine must be stored at a specific temperature, which requires reliable cold chain manufacture. World Health Organization recommended improving the cold chain manufacturers, transportation, and healthcare facilities to ensure safe storage and distribution of the vaccine. All right, and then we're going to have Jana conclude our presentation.
Thank you, Kishandra. Cervical cancer poses a significant public health challenge in Malawi, marked by one of the highest incident and mortality rates worldwide. This disease is driven by a high prevalence of HPV and exacerbated by limited access to HPV vaccines and cervical cancer screening programs. Efforts to address cervical cancer in Malawi include expanding HPV vaccination coverage, increasing the ability of screening programs, and improving access to effective treatment. Overcoming these challenges requires substantial investment in healthcare infrastructure, enhanced education initiatives, and increased international support. Thank you for viewing our presentation. If you have any questions, please feel free to contact us on our email addresses listed on the PowerPoint. Thank you.